This is Touch Talks Wellness from Martha's Vineyard. Listen to your heart, a conversation about heart disease.
And then I will give you some facts about heart disease and Black people. So, yeah, a review.
Hello, good afternoon, everyone.
Your mic is on.
Mic is not on.
So, you know, over the phone. Here.
Everyone, my name is Theodore. I'm a software company co-founder. I asked
That's good.
Good afternoon.
Yeah.
My name is Akoshia Yoba, and I'm an educator, a writer, and builder of people, places, and things.
Yeah.
Making sure that the programs and medical devices that we develop are related to all people regardless of where they come from, and we can do research that represents the patient that we want to do.
Awesome. So, you guys, heart disease is really a huge killer, the number one killer of people, but especially Black people. And Black adults are roughly 30 to 54% more likely to die from cardiovascular disease than white people. Did you know that? And there's a lot of reasons, but there's stuff like high blood pressure. Who do you know that doesn't have high blood pressure, right? Obesity, diabetes. How many people do you have diabetes, right? It's also happening under the age of 50. And that's crazy, right? So why are we dying of heart disease? Maybe stress, hello, right? And then also family history. So I think we're going to talk about all of that today. And I think we should start with the I think, crazy stories of my friends who had the disease. So, Akoshia, you go first.
So I was about 42 years old, and I was a secretary. I was working out martial arts about 5 times a week, meditating, doing all the things. And one day, after a very stressful event, I had crushing chest pain, which led me to think I pulled a chest muscle during thigh bone. It occurred to me that it could be my heart. It's on the right side of my body. I had no other symptoms, and I was young and I was healthy. So heart literally never entered into my mind. So I let it persist because I thought I had a full muscle, and sometimes they take time to resolve themselves. So for about 12 days, I dealt with this intermittent pain, and then it got so severe, I went to a hospital, and that is how I found out that I had a artery that was 70% clogged, and I was immediately rushed to get a stent the very next day. And 20 years later, here I am.
I think the numbers are 60% of Black women. Those heart disease are really hard to kill.
I'm glad to be alive.
I know we're going to so glad to hear from you.
Okay, well, my story is a little bit different now. I'm going to start with my parents. Our grandparents were living my grandparents had a farm, and we never so much. So we grew up eating on farms. And I think that's a large part of where my history originated. At the time at which I found out I was having challenges.
Can you guys hear him? Okay.
Everybody around.
Yeah.
Well, I got what actually happened. One year, I was going to get on the plane, and I literally can't stop. You can't seem to calm down, right? And then all of a sudden, I'm extremely nauseous.
I feel like I'm being served by a different percentage I had in this ratio. And if it's really nauseous, if it's really busy, if it's just taken out, tell the guy next to me, you gotta remember. I gotta go back to the bathroom, to have 2 Cokes, because at this point, the silver lining flashing. I know I'm gonna do this. The flight attendants are kind of leaning back, and I see other sweat is pouring, my shirt is red, I have this kind of book on my face. I take a Coke and put one on each side of my head to try to cool the blood going in that run. And I get into the bathroom, and in this bathroom, I don't open the door, I get the fan. When you get the fan, you know, the can't be going to leave. So I get the fan, and I look at the big bathroom, so I put my feet up. And that's the only way to keep the blood on my head when it's down to get you're in the bathroom, you fix it, and you fix everything up. And at that point, if you fix it, I'm still flashing lights, still very raised on my arms, still feeling like you reset. And then there's a guy on the door and this really is open the door. So I open the door and like, what is going on? I go, listen, I know, but that doesn't what's going on in here, but I'm okay, and it's in. Right now, it's like you're taking my picture, you know, it's not, right? So anyway, get in there, let them close the door, let them put the fan on, come back up, and slowly this temperature begins to abate. 40 minutes later, I leave the bathroom, and then by the time of 20 minutes, I'm fine. It's fun, so really play out of this, like, I'm going to they keep drivers.
Why did you have a cardio?
Oh, well, we have a family history.
Okay, keep going.
But I'm drinking. So then, but at this point, by the way, I'm everywhere. I'm going to an exercise there, I'm going at least 12 miles a week running, 25 to 50 miles on a bike, exercise every day. But all my friends that works. So then I'm on the motorcycle in the cell phone laptop, I do what I can get it, we won't start, I have to push it up a curve. But literally, it's like from here to the ceiling of the stage, and all of us singers come. Right? And I'm trying to put the big motorcycle out of the street, I'm praying that Jesus, Yahweh, Thor, somebody will have to take this motorcycle out of the street and not so they're laying on me. And I'm across the street from my brother's office. But it's like, you know, I'm gonna walk across the street. At this point, we get to the Washington Hospital Center, and they're running tests every hour. It's drawing blood. If I was going to get that, I wanted to leave, and it wouldn't let me leave.
You can say it.
Okay. So we're in there, and I'm listen, I gotta go. My son's going to South Africa tomorrow. This is totally like I might see. I got stuff to do. But if you bring us notes, my mother's notes. My father was, by the way, the dean of King's Western Reserve Medical School. Long history of medical professional. Good enough, and he's just like there's a cover now. The next one is she's got the plan, and she's got the hand glasses with the phone necklace, and she's got a happening through her feet. You sit down, one looks like you really need to meet. That's the sort of face. That's good. You're not a friend, and from the whole world over here. If we're going to put you in a room, right? So I'm telling you from another house, drawing blood, drawing not a book. Don't go to the but there's a doctors, the doctor, at least she's on, right? She comes with 2 orderlies, and I go to take her hand and put the orders down. She's like, Mr. Williams, if you need dinner, you will come back to the basement, because you know, you're going to have it right now, you sit down. But they figured so long with the veins and the blood flow around it, so they only trigger right? And then they found out that another artery was 50%. They wanted to treat this. You can't run anymore, you can't ride the motorcycle, so we got one way that we got another group of automatic basic specialists. And the cancer you have right at the phone, if the way you see your artery, you believe that I'm not living that is nothing you can do. But I didn't want to change my life. Went to the surgery, but I had a video of it. The video was working, it just showed you how it looked like this. And then after the surgery was over. And luckily, there wasn't a lot of damage to the heart muscle. but I still exercise, I still run, I have changed the way I eat. And by the way, I was told 5 years before that if I ever change the way I eat, when I was speaking to my children to drive. What we eat is very important. I ate like a farmer. I would go cook a pound of bacon, 4 or 5 eggs, and go run 5 miles. They don't can't do that. They can't do that. So part of it was that, part of it's not in history, but it wasn't that radiating medicine, it wasn't the left side of your body. It
was Uncle Fred Sanford.
it wasn't, oh, thank you, it wasn't that. And your body is talking to you. My body is talking to you. You know about if I work out real hard, it might feel like what's going to kind of that's my body telling me something. And I'm listening. And I keep mind. And I'm like, I think keep. And so that's the shorter version of
Right.
most of this.
I think along, but it was good. You did good.
So yeah, you said it's so important, which is, and you guys talk about that standard thing, but that idea that concept came from a vision as to what coronary artery disease represented. It was a chest pain going down the left side of the arm. There's a very specific view that happens in actually the minority of cases. Most people have very different symptoms. So one thing I just want to share is that if you do have that feeling where you're nauseated all of a sudden, or you walk up a flight of stairs and you get short of breath, for example, or you get dizzy with like a little bit of exertion, those things can be what's called an anginal equivalent. So that's equal to that sort of same concept of ripping the chest. So to recognize that cardiac disease and the symptoms can be really all over the place. So something not feeling right is what you need to. And the next thing is to think about in a current environment, the kind of screening tools that are available to us. And that there's 2 I want to leave you with, and they're both imaging tools. And I say that because you probably hear about people checking their cholesterol level and Lp(a) and a few other markers, all important. But there are two scans you can get. The coronary artery scan that will tell you the risks of coronary disease. And then the second one is the echocardiogram that speaks to the function of the heart. Both of those are non-invasive and a good way to sort of know what you're basing on risk is and put them in after doctor.
Dr. Pierre, can you talk about Lp(a)? I've been bringing up to a lot of people, and nobody knows what it is. And it's done.
Yeah, absolutely. So, the cholesterol that we eat, whether it's butter, eggs, or what have you, first of all, when you eat more cholesterol, you synthesize a little less. So there's a balance. But the fact is, when cholesterol and fats go up in the body, the liver puts them all together in little packages. And those packages get the name things like LDL, for example, you probably hear about. And that's how the liver can send fat and cholesterol around the body. It stores the fat and delivers the fat in these small packets. And Lp(a) is essentially one of these lipids, one of these fats that fit in those particles. And we have no control over it. Doesn't matter how much you diet and how much you exercise, it's determined by the genes. And the type of Lp(a) variant, the variant that you individually have, will determine your risk of cardiac disease. Now, if you say, look, this is my genes, then what am I going to do about it? It sort of suggests a risk. That involves other things, so being active, like you suggested, and diet, like you spoke to, and exercise, and high blood pressure, all these things everybody should do all the time. If Lp(a) is high, all those other risk factors need to be managed to the overall risk of cardiac disease.
So we can't do anything about it. And what I learned recently is you can't even you're not even normally tested for it, right? Because it's not in your normal blood work. But we should be asking, do you stick to that?
Yeah, absolutely. You hit the nail on the head that market has become more standard among cardiologists and preventive cardiologists. But the fact is that there's actually 2 separate things. One called Lp(a), and the other one's called ApoB. Those 2 tests pretty standard. So other cardiologists, I've heard about it on a panel markets in you, can I get these 2 tests? Pretty standardized and give a really good picture as to your risk of coronary artery diseases. Because the one tells you your genetic risk, and the other one is almost like LDL, it tells you factors that you can control with diet and exercise Even things like statins that drive down or things as well. Those are two tests, LPA, genetic side, and then ApoE for the factors that you can control that helps to determine the targets.
So frankly, there's a factor that's genetic that you could get from your parents that you can't do anything about, right? So you can't do anything about it. It's just there. So that's why it's so important to control all the things that you can do something about. Even more so than if you didn't have that, right? Or didn't have high levels of that, right? It's more fatal to you, right? So more just a harder things to deal with, right? But I don't know that we're talking to our families about that. Anybody know if you have that? Or have high levels? Yeah. Right. How did you know? What made you find out? Yeah.
Pacemakers or something in the 30s. I have another cousin who had heart so my father and so and then I
Yeah. Repeat your question hopefully further so we can do on the recording. You're basically saying if you don't necessarily have a history, can you get full through your insurance cover testing for things like this? And what's the language to use?
Yeah, let me jump in. Walking through it, whatever. One of the streams that we talked about today, so lipid profile, obviously blood pressure, hemoglobin A1C, those sort of five markers, those are routine primary care laboratory values that every physician could be and would be willing to order for. So I would say start there. And then what happens is that you have that again comes back. So, really, this is significant risk to you. Here's someone with diabetes, elevated blood pressure, and elevated cholesterol, and has some symptoms, then you need to think about more aggressive screening tools that I spoke to earlier that go and get a score. So it's kind of a gradated approach, right? So starting out with those screening tests that I mentioned, the hemoglobin A1C, the LPA, the cholesterol. It's a fatal, right? Go to your local drugstore and get a blood pressure. Know anyone in town knows the exact blood pressure numbers, a lot of people. Number one preventable cause. We say it all the time, but it's also easier on your blood pressure.
You know, I've always had low blood pressure, and all of a sudden, I'm not sure at what point my family told me that I have a personal heart. And no one's been in the room with me, like, I don't think I've worked over the years, but so my friend is a cardiologist, and said, you know, I think you should do a sleep test. And so I guess the way the sleep, and I'm not a doctor, but the sleep test, you're only supposed to have 4 incidents an hour of when you stop breathing. Mine was 31. And so my friend, the cardiologist, she really called it the next morning, kick your butt over here now and get, you know, lift up and really get a CPAP machine. So I think that was driving my blood pressure up. So after 6 months of controlling my snoring, my blood pressure went back to normal. It's caused by a suggestion. So I know who snores out there. If you don't know if you snore, sleep with somebody in the room with you. When I first started using the CPAP, and I hated it, but it's saving my life. Right? And I think little things like that. I mean, but check your blood pressure. You know, that's an easy thing to do. And we know the numbers for blood pressure are crazy for Black people. So.
Once you have the episode, you're really drugs that you never. That's probably the blood pressure. It's specifically for them. There's 2 others that affect you. So now I've got 3 medications that affect my blood pressure. So goes wrong. So came out of bed, came a different blood pressure. It's literally risk side, risk side. You carry it with you. So it's one of those things where get ahead of it. Don't get behind it.
Don't get behind it.
Don't get behind it. Once you get behind it, you're going to for life. You know, I've got 2 studies. By the way, the other wasn't 50%, but 80%. They have here for clients. And you don't get a 3rd shot of this. I'm making sure I hang out a little bit.
I'm happy to say that my numbers have stayed pretty consistently. They're almost the same as they were when the incident happened, because that was a wake-up call for me, that the way I was eating, which was pretty clean, working out, those were things I had to do for the rest of my life. And then meditating. I have a type A personality, and so I was calm myself down. And so I think it's so important after you have an incident to really up the ante on how you take care of yourself. It can't just be for a moment, because you got to stay.
Support big point. And something that relates to what you just has been also earlier, you mentioned about the food bathroom is actually important to sleep. You eat all the time, and you have to sleep well. You now recognize that is actually part of the important drivers of pulmonary artery disease, growth and dementia is actually sleep. And I don't know if you're like me, but a lot of times you're going all the time, and you get what's called poor sleep conditions, like towards the end of the day, and a lot of electric light. And if there is sleep, then it's not just that it makes you fatigued, it actually contributes to an inflammatory state, is what we think coronary disease is. So I just want to put that on the table as well, to think about the quality of sleep that you actually have.
And I think, you know, we all, I know it's Black women, crazy type A women, helicopter moms, working crazy hours, doing all this stuff, and we say, oh wow, I can live on 4 hours sleep. And we're proud of that. I can live on 6 hours sleep. And we think that's a good thing. But it's not a good thing. I would get at work and distract my sleep because, and the sleep apnea machine distracts my sleep. But you really do need to sleep. And, you know, I'm going to force myself to sleep 7 hours, but I do that. I practice that discipline because it is a discipline, because we can easily get on a plane. I'll take the 6 a.m. flight because I can be back by dinner, so I have to get up at 5 or 3 to make the 6 a.m. flight, get back by dinner to feed the kids, do the homework. I did that so many times. I used to have a rule that when I was in corporate administration that I would only be away from home 2 nights for my kids. And so if I was still in California and I was in Atlanta on the 3rd night, I would fly home, cook dinner, get the kids ready for school, and go back the next day. It was crazy. But I think we all do make these sacrifices for our families just to go to cook dinner. Something stupid like that. You know, I know that's not easy. I'm not what we But still, and I think we all have these sort of disciplines that we've inherited, that we've sort of adapted over the years to take care of our families and do what we have to do to put food on the table. So let's talk about just the risk factors. Can you kind of go over those again? So what people should be looking out for, whether it's high blood pressure, what are the things? I mean, you guys were shocked. You were shocked.
Definitely.
Yeah. So how do we
Oh,
help?
my God.
And so was your doctor, yeah, because you were so young. So how do we, and you were both young. I mean, how do how do we help people think about what to look for and hopefully not looking for when they're having a heart attack, when they get a stent, but what they can look for just so that I'm, plant the seed for what could come.
I think make a statement before you start. And everybody refers to it, and let me just say this. Black man, do this. The biggest time to it behaviorally, the nutrition. And that's where people have us, but we eat like our parents. Sometimes like our parents, something we as a culture, we shouldn't be eating. And I'm learning this thing about sugar. But we made it, black people, they can take where anyway. When you grandfather, he would work 2 big jobs. He was tougher. He was on his feet. I have to put it back to him. And that was in the field. And he was they don't know about it. They don't really know. They really got into the field. I said it really powerful as important. You can respond to risk factors and come afterwards and I'll go through the data. So we can use those factors. Something I think you're talking about is having a trust in the system that people interact with. If you ever go into a position, and look, I know I've seen it firsthand. I'm a physician, I see my colleagues, I see how they interact with patients, I see a sort of built-in prejudices that exist inside the system. And I think you can feel that, when you see that, it's hard to follow that person's advice. If you feel that all the humanized in that clinical setting, from the person at the front desk to the person that, the pocket glass, anywhere along that chain, including the physicians and the nurses, where you feel humanized, it's hard to have trust in it. And I guess what I would say is that it takes a little extra shocking. And it takes a kind of position that resonates with you. And I don't think it's necessarily a background on the individual or whatever, think it's that when they speak to you, you have the confidence. And I would think that's like one important risk factor there is, are you believing people understand? I understand what Cardi was.
You know,
It's okay to do that.
she was big in the house. Didn't go for any extra effort. And finally, I had to take care of myself in my heart, and I'm looking at you, and I don't believe a word you say. So, I'm happy to say, to your point. I have a group of doctors that have helped that. It started with one who was very to the next two. So respectful of Pierre. Like I have one who literally, oh, his liver. He's so respectful. And I say now, when I get testing, my doctors treat me like an white woman. So all the health burdens we hear about, do not have anyone in me. They're giving me every single thing, to them. And they're so respectful, and it's time to find them. And I think it's important to take the time to find them, so they become partners.
Exercise, or they need to change your diet, but I'm looking at this guy. You can tell this is good. Okay. You can do it. But then, instead of not just talking to you and he can't really look at you or in his nose, this is the voice. The spirit speaks to us. We're spiritual people. We are divine in our nature. And I can tell them, cheat out the next one. I'm like, all right, I'm going to see what you say, because if everybody can have respect, if you're homeless or a CEO, I'm going to treat you with respect, because that's my call, the child of the divine. But if they're a C student, find yourself an A student. I need the doctor to look me in my eyes and say, yes, when I got this system, I got a video and I can show you, but she's showing me the video. I can show you what my artery looked like. Look like this. And when they were done, I'll show you the video. The whole back part of my heart was not getting the blood that it needed. You can see little babies turning blood, keeping the muscles. But unfortunately, there wasn't a lot of permanent damage. When the muscles were getting enough to be done, really respond to what I was trying to do. That's why we're going to reach to program that. Just
Look for the activity. Look for the activity. Rather than, thank you. We're gonna wrap up this channel. We have more to come because one of the things that we both touched on was the emotional side of it, the stressful side of it, where you have. So that's what we're going to talk about now. How do we alleviate some of the stresses on us to get to a place of peace and hopefully prevent heart disease. The other side of your heart, right? Mm-hmm. And so thank you. So much. Thank you guys. I love you. Let's get a picture for everybody. You need to call your brother. He's right here. Where is he? Sorry, that's not good. Malik, where are you? Come back up here. Come in. My brother's He's snuck in. Come back up. Come up here. I'm gonna let him tell you his story before we move on. Come on up, Carol. She's not in. So this is my friend Malik with Akoshia's brother. We have a great story of how we met. We can tell you later, but I want him to tell you, share his part story as well. Yeah, can we do that? Yeah. No, it's okay. I left him at my house on a.
It's like it. Y'all think I'm joking.
So share your story. No, your heart story.
What do you like?
We can share that story. We all want to.
I know. I had quadruple bypass. You discovered, what the disease was. So, okay. Suddenly, that I got up from life. And it persisted over a few weeks. One day I was going to the gym, 3 blocks. He gave me protocol for heart. It took a second, as in a few months, to do a test and ultimately well, the echocardiogram and then
And your friend.
the angioplasty. Consistent there, either way, working out 4 or 5 times a week, you're doing all the
You
things.
got me addicted to wrestling.
Salt better. Yeah, I do salt better 4 times a week. And, thinking I was beating. Yeah, I've never had to meet. Yeah, big, then you learn. Hey, you realize, learn the standard test that you get. There's a lot more. There's a lot more information that I was choosing one I get married to, and it's a scene right before my character gets hit by a cat and saying that. You like to say, "What's the one here?" They're like, town, if they have a community. And then we've done plenty of business over the years. And then soon after, we occurred. And so, we is that and pivot and make this about the ground. Blessing is understanding it. They're not completely listen.
You know, they need to get out of it. What does that mean? What is it?
Tell that.
The big cigar. Maybe I can go about that.
So I'm John Marco, and it's really divine work. I'll tell you how I'm so brand new to I was in the main National Assembly, and you see this woman in front of me. She had on the most fabulous, bedazzled tennis shoes, green and white, and she has a little dog with her. And walking through, the dog is in front of the security. I was big one. Anyway, I see her and I'm complimenting her on her glasses. Because I'm blind and a lot of people with glasses. We go our separate ways. So I am with Jimmy, which is the first celebrating our 50th year anniversary. Funny, work for a company was younger than you, but that's neither here But I just transitioned from being a sales vice president for the North region to working in population health. And so I'm now, my role is to really find organizations to partner with, because biotech companies, pharma companies, the medical industry, the pharma industry, not necessarily trusted. So we need to do the work so that we can make sure that everyone has access to our innovation. So in my new role, part of what I'm trying to do is to build these strategic alliances and touch with one of the companies that Janine partnered with. And I have not met you. Someone actually offered to broker a meeting for the two of us to meet, and we were in the Detroit Airport together. You were on the pictures, and I can't remember the privilege of it, but I guess I'll just get on the phone. We sat there talking about the family and the friends that we have in common. We didn't do any business that day. But it just doesn't happen by happenstance.
Genentech has been our supporter from my first big grant that allowed me to do really set the platform for the research that I did about breast cancer and clinical trials. It was a foundation for us.
And it's why I joined Genentech. So I've been in the biopharma industry since, well, this is almost my 40th year. I was a class business for 32 years. And I joined Genentech. And the reason why I joined is because I saw that this company was doing things differently. And it wasn't just, oh, well, we're going to do this, it's going to be over in HR. Every single officer of the company, as an officer, tried to put together a D&I plan. How are you going to work with health equity in the work that you do? And everyone who was one from the CEO had to put these plans in place. And at the end of the year, we had to come to your plan. I really need some of that. Because we really wanted to integrate it into the business, the everyday business, not just sit it over in a corner in HR or in a D&I group. And
When
so
we started that, I got the first health equity grant.
from my boss, yeah. So yes, so we are here today to talk about a little about population health. Yeah, talk about you're the first biotech company. I'm going to slide. But go to the next slide. And really population health. So what is that? It's really the integration of science and policy and innovation integrated together to improve health outcomes. And how do you do that? You do that because you are putting all of these things together and then working in partnership with the community to pull it through. And so, my role is really broader than it encompasses all of the therapeutic areas. And we are really looking forward to the things that are to come that are really going to address some of these major issues that we're talking about relative to cardiovascular disease, and particularly in our community. And so that's what population health is. And our mission and our goal is to really improve health literacy, to make sure that people understand what is happening to them, understand what their medications are doing. We actually have people in the field that actually talk with patients so that they understand what's happening. We're also really trying to make sure that with health literacy, did you know that 54% of people don't need a 12th grade level, like below a 12th grade level, which means that at a 6th grade level is where most information, in order for you to be able to digest it, that's where it should really be. Our information was actually written for like, I think it was 12th grade level. We were so proud of that, but nobody can understand it.
Right.
So one of the things we're trying to do is to make sure that people can understand the information so that you can ask the questions and put together tools so that when you go to the doctor, you've already thought about it the night before and you've got your questions already. So we're really trying to, I'll call break the cycle of getting people not engaged with their own health. It's like going from being a patient to being an advocate for yourself, or if you're a caregiver, to be an advocate for that person that you love and that you're caring for. And so that's what's really made the difference. And so this population health work, it is God work, because these are the types of things that just get in the way. It puts sand in the gears of people getting the health and the health care that they need. And I'm just excited to be sitting with you today.
I like to say it's putting it in words we can spell.
Right. And really understand.
Right.
I think I went through all this. Yeah. So we do have a bold ambition of trying to reach 1 million people to make sure that everyone gets the diagnoses early. Because you know, if you're diagnosed early, you can intervene early, you will absolutely have better outcomes. And that's really what all this work is all about.
Yeah, and we're videotaping this, so you guys can go home and show it to your friends on YouTube and your family.
And these are the pillars that we're focusing on. When you talk about, you know, closing care gaps, make sure we're maximizing community reach, doing things like this in Martha's Vineyard, at the Links Conference, at the Boulay, to make sure that we are going where people are and where they're open to listening to what it is that they need to hear about their own health. What are the questions that they need to be asking? What are the, you know, the things that need to be taken into consideration when they're thinking about their own health?
I like to say we go where Black women live, work, play, pray, and slay.
That's right.
And that's where we come to the vineyard.
That's right. So, you know, this video worked when it was on a computer. I'm not sure if it's working now. I'm seeing a head nod. So we're going to just jump right into the agenda. So I want to tell you, in addition to, before we jump into the question, I want to talk a little bit about like my story.
Yeah.
Because I was listening to everybody's story, and I will tell you that my mother, I got married in 96 and we moved into our house in 98. My mother was 54 years old. She missed a step, broke a leg. Now, I'm living in Philly. I'm from DC. She was visiting us. And so my mom had to stay in my house with a broken leg, my brand new house. And went back to DC. She got a clot on her leg. And so, what do you call it? A thrombosis. And so they put her in Washington Hospital Center. They're like, could you just run some tests and see how things, what's going on? 3 blood drivers. One was almost fully occluded. Christmas Eve, 1998, my mother had triple bypass surgery. But thank God she broke her leg. Because otherwise she would have had a massive heart attack and death. My father passed away in 2003. I was 9 months pregnant with my baby Noble. And he was 59. I will tell him I'm as old as my father was when he died. Like, this is personal to me. And so if I can say or do something that will help somebody say, you know, what is that pain? What is happening? Then that's my charge. And I've been a sales leader for the past 25 years. And God has ordained for me to be in this role, doing this work with these people right now. And so I just feel blessed and honored to be able to do this work. So I want to say that. And I applaud each and every one of you for not being at the inkwell, but here to with us, listening about how you can do better for yourself and for the people that you love. Okay, so I think I'm supposed to ask you some questions.
Okay, I'm ready.
Are you ready? Okay.
And they can help too.
Okay.
You jerk back to me. You're telling me stuff. Yeah, I want to talk to you.
So, Ricky, you have spent more than a decade telling women to speak up for themselves in a doctor's office. What made you start that?
Because my doctor told me I was gonna die,
Yeah,
right? You know, my cancer came back after a year, my triple negative breast cancer, I did all the things, I cut my boobs off, I had a lot of chemo, radiation, and then my cancer came back. And my doctor said, we have no more drugs for you, get your affairs in order. And I said, you have 2 years. And I said, I can't retire right now. It's not on the list. Haley was a sophomore at Dartmouth, I had to pay tuition. I had to get my kids to school. So that was my motivation. And so I had to go fight for myself. And then I went to Dr. Google, which is not the place to go. This is way before AI.
86% of people, that's what they
Yeah,
do.
go Dr.
When something
Google.
happens, that's
And
the
on like
first.
the third page of Google, I found the Triple Negative Breast Cancer Foundation. I called them, and my dear friend Haley Dinnerman said, I'm going to help you find a doctor to do a clinical trial. And I went to Emory, and my doctor went with me because she was young. She knew what she was doing. She admitted it. She only had 2 cases of triple negative breast cancer, and both of them died really fast. So we went to this wonderful doctor, Ruth O'Regan, and she put me on a clinical trial.
Love it.
And it'll be 15 years, September 20th.
We really make sure that we are engaging with, and that is being part of clinical research.
Yes.
That is where the cutting edge medicines are, and there's not enough of us in the clinical trials. 70% of all the genetic matter that is in repositories right now from clinical trials is European. So you think about AI, as it's starting to develop treatment algorithms, what is the data it's using? It's using data that doesn't necessarily include our data. So in order for our data to be included in the data, we have to engage in clinical research, and you get to be, I'll say, cured from things like breast cancer. And I forgot to tell you, Ricky, I think I told you, my mother also had triple negative breast cancer. She found a little lump right here. She just had a clear membrane 3 months before. And she said, something doesn't feel right, so listen to that voice. And I went to the doctor, and he listened to her, also important. And by the end of the week, she was having a lumpectomy, taking out the drain to see what's going on. And she was treated radiation and chemotherapy because there's really nothing yet really for triple negative.
Now we have 3 drugs.
Yeah, we're coming. Things are coming. And she's 82. July 1. I'm 82.
Can I ask a question? So how do we engage in a meaningful way with research?
Yes, the best thing that you can do is you ask your doctor, do you know about any clinical trials? The second thing that you can do is you can go to FDA.gov. They have all the clinical trials that are going on right now. You just put in what you think you might have or what your doctor's told you have, and you can see all the clinical trials, where they're being held. And one of the things that Genentech did right at COVID is we knew, because of the demographics of what was happening with COVID, we said, we need more brown people to be a part of these clinical trials. But what happens is most of the clinical trials are in, high velocity areas where there's lots of people, but we don't get asked to be in them. So ask your doctor. And so we started the Advancing Inclusive Research, which started with 3 alliances, and now we're up to 40. And what we're doing is we're actually putting in place the processes that's going to help to get more Black and brown people enrolled in these clinical trials. And we actually are getting it into a rhythm and into I'll call it a science, to get more people enrolled in clinical trials. And so first ask, second go to FDA.gov. I think we have a QR code.
We do. And I'm one of the 40.
You're one of the 40.
So we actually are, we help recruit. We have a 5-year contract with you. Did you know that? For all of the breast cancer trials. So now we basically recruit for Genentech, for breast cancer, for all the trials. And we provide 24/7 navigation. So for the patients that are in the trial, we have nurse navigators. They're all breast cancer survivors. They're all Black women, and they're 24/7. So we're part of that. We actually helped start that for them. So, and we're proud to be doing this work to help recruit. We also now, in about probably 5 days, we will have an app. So we actually have a website now, whenwetrial.org, where you can search a breast cancer trial, and it pulls from clinicaltrials.gov, which is like going to hell. We put a hug around the science, and we help explain it and put your data in, and we will have an app in 5 days that will do that for any trial. And our nattrials.com site. So we'll be able to pull the trial and give you a hug while you're doing it, so you don't have to understand science, and then you'll be able to spell the word.
That's right. And then there is a handout at the front there, healthycommunities.com.
Yes.
If you just scan that QR code or go to that website, and you can navigate and find information about a lot of the clinical trials.
And we're happy to help you. Our navigators are always here. Great.
Yes. So Ricky, okay. So what does a woman who knows how to, oh, did you have another question?
Yeah,
What was your question? It's on the
forgot. No. So Ricky kind of answered part of my questions. What's the actual mechanism to making sure we recruit more people? Because it's funny you saying what you're saying, because I was thinking this morning, like, I'm about to be 59, and I do manage hypertension, which is a lot, right? To stay on top of the changing medications and lifestyle I've been dealing with since 24 years old, right? So, but I was thinking about how little we know about how work from young, and just thinking about how important it is to just have this information on younger. So when you say that you have a mechanism in place to engage people in clinical trials, what flashed in my head is the dudes on the corner in Fort Greene Projects in Brooklyn that I see every day. And they look like they've been hanging on the corner for 30 years, because they still dressing like they're young, but I know we all about the same age. And so I'm older. And you mentioned the Boulay and the Links, and I'm thinking about the dudes on the corner, right? And we think about those that don't have access. And I'm a storyteller, and I'm a marketer, and I'm a lot of things. And so Ricky kind of answered the question saying that they are a partner, and then I thought about us and things that we're doing. How do we become partners to make sure we can amplify what you all are doing? Because this is not a B2C company, right? So there's no public awareness of the great work you're doing. So my brain is going while you're sitting here. So I'm thinking, what else are we doing? See, I did that. What else?
Can I bring this up before you answer? Because one of the things that happened recently in my latest doctor's visit is I took this book that was generating of all of my medical history when I was having problems in the heart attack, and I took it in. So this is now 12, some of it goes back 20 years. And you look at my A1Cs then, my A1Cs now, all these years of medication, the numbers are better now than they were today. And he said, part of the challenge is they're holding you to a standard that your body might not be applicable to.
Right.
As a Black man, your diet, your actions, the things you do, your body frames.
Well, just how stressed growing up Black under my father's roof.
Oh, yeah. You didn't know when the blow was coming.
Because I know, we're doing this global research now, and I actually went to London a few months ago to this lab we're working with, and I said, show me a triple negative breast cancer cell, a Black one versus a white one. I want to see what they look like. And they look nothing alike. Nothing alike. When you start talking about LP(a), why do Black people have it and the white people don't? And why isn't there a medication for it? And so there's a lot of science that hasn't happened yet for our bodies because we haven't been in the clinical trials, and a lot of work to do there. But I think, so that's one point. I think there's more work, and we have to keep pushing that work. And that's one thing Genentech is really doing a good job of. I think for the people on the street, though, one of the reasons why we come here is because I want you to go home. I want all of you to go home and talk to those people on the street and help us.
But I'm saying we're on backup, right? So
we're not here.
No. I'm just telling you where my brain went.
Yeah.
We don't know each other, and you may not know all of my history. You might know me from film, but I'm a guy that started in the community at 16 years old, working in education. We have a foundation. We do a lot of work on the ground with humans, right? We have something we do called flipping the, I have a real estate development firm, right? That's at the intersection of real estate, education, and media. So I'm always thinking through the lens of storytelling. I'm always thinking through the lens of dots that need to be connected, that are connected. So just in the way that we use media in the real estate business to amplify, where are the pathways into the space?
I would love to talk to you about
It's not taking over, because I'm sitting here, I'm just saying, like, where my spirit is going while you're talking.
And this is what I would say about some of the testing, some of the things that are done. There's dominance and there's recessive. As Black people, our origin, we are the dominant, and you're testing on the deviant, the recessive. And white culture came from Black culture. You can't go from white. So you're actually testing on the mutant. And then you begin to test on the original.
Well, I think that there is a there, and I think we should talk about how do we, because we do things like we take out, screening bans, and we have a love letters campaign that actually goes into the community that has people that look like us on these love letters, so that people will actually say, hey, that looks like me. I think I want to know more in different languages. But there's always more we could do. And what I will say before you finish, is that, when most companies are walking away from this work because of the climate that we're in, we're actually doubling down.
That's why my brain is on fire. Because I'm saying we could be on the beach right now.
Well,
no. Having this conversation is what I'm saying.
Yeah.
Like, I'm thinking Jay-Z's concert, and I'm thinking, how do you integrate this message into pop culture? Like, you talked about 12th grade reading levels, but adults are watching and learning off of TikTok. Yeah. So the storyteller. No, but I understand that. But it's okay if they're not reading, but they will watch it and they will listen to it. It's the delivery method, right? And so if you're doing this great work, I'm just saying that you have other assets. Well, I'm just saying you have other assets that are sitting real close to you.
We got you.
That's
The connection.
And I'm saying reconcile, by the way. So I help to assist that dressing. I mean, my sister. Turned my sister and then turned her back to us. I see what's going on all day long. We look back.
You go to our first polling question. Make this interactive, and I think we did that. So why don't we go to our first polling question? Is there a QR code that's going to come up? Oh, there it is. Is that? Okay, is my head away? Okay, there we go. Okay. So the first polling question, so take out your phone and then scan that QR code and then answer the question. What is the hardest part about putting your own health first?
Can you see the answer? Are we blocking it? Finding time, making appointments, knowing what questions to ask. Okay, look at what I hit up there. Yes, finding time. Prioritizing myself ahead of my family.
That's what the men is, and that's why I'm starting down.
All right.
So time.
Oh, it's finding time. Yesterday I was at an event, it was an art exhibit, and they had a talk back with one of the artists. And she said, this whole thing about finding time, we tend to put other people ahead of us. We tend to always say we can't find the time, that something else is more important. But you have to book it just like you book anything else. Yeah. You have to book it just like, because it is so important so that you can continue to take care of others. Find the time. Just like I'm like, my calendar was controlling me until I said, you know what? These are my 2 hours, and I'm going to do with them what I need to do with those 2 hours. You deserve that. We each deserve that. You may not think, but you do.
Prioritizing myself.
Yeah, ahead of my family. So, like I say, put your oxygen mask on first so that you can help somebody else. Right. So, okay. So now, we're going to move into the next section. Sure. Let's go. All right. So,
well, I think I talked about it a little earlier. you know, when most of us hear about heart health, we picture Fred Sanford,
Just the heart, right?
right? But it's not just that. What are we really talking about, right? What is it?
Right.
What is it?
It's a system, right? The heart is just, you know, it's a system, like your kidneys, your metabolic system, it's all connected. And while the heart is, of course, super important, your kidneys are important, your, all the things we've been talking about in terms of your cholesterol, you talk about, little a,
LP
little a. My LP little a is 201. It's supposed to be below 70 or 71. Now, I run marathons, I eat well, that has nothing to do with that 201.
You can't change it.
And I cannot change it, but I guarantee you that's why my father passed away and why my mom was on the road to having a heart attack at 54. It all works together, and if you're not knowing what's your blood pressure, not knowing that having high blood pressure can impact your kidney function, not knowing that, you know, high blood pressure is actually can cause a stroke. So these are all the things. So it's not just your heart. It all works as a system together. And understanding and knowing what your numbers are when you go into your doctor's office is super, super important. So I don't really think it's just about the heart because the whole body functions together as a system. So knowing those numbers, your cholesterol, your LDL, you know, like Dr. Theodore was saying, you know, there's nothing to treat little LP little a, but if you are managing the other things, it kind of mitigates that as a risk factor. So that's super important.
Yeah, and I think even I brought up earlier about my sleep apnea. You know, I had high blood pressure all of a sudden. Where'd it come from? From sleep apnea. So if you think snoring is cute,
It's not.
it's not. If you think it's just annoying, it's not. It could cause high blood pressure, right?
And hypertension is a silent killer, and you don't. It's not something that you feel. You have to know your blood pressure. I'm gonna find out what is it. I want people to know this thing that you said that you carry as a blood, because that's really important. Because who wants to be able to have to lug around a blood pressure cuff?
Right.
Let people know what that is.
I wish I had brought it with me. It's about in the carrying case. It's maybe 1.5 inches thick, and it's about a little bigger than a credit card. You put it on your wrist, and the wrist has to be bent level with your heart, and it's a full-blown blood pressure cuff. And it has a little light that shows you if your arm is in the right place. Because if your arm is on here, it doesn't work. Here, it doesn't work. It shows you exactly how to do it. And it's like $35, $40 for the first. And it can save your life.
Yeah.
If your high blood pressure means, I use it now to tell me whether I should take my blood pressure. Because if they're low, you take it, you know, it's a wait.
And 50% of people in the United States have
Yeah,
hypertension.
that's how I look it up.
Yeah, 50%. And
How many
only
don't know?
well, the other 50%. one in four. No, really, but they don't know. You don't. People just don't know because you don't. It's not something that you can really feel. So, because I'm hypertensive.
Yeah.
And I'm on blood pressure medicine. I didn't feel like anything was wrong with me.
Right.
And only 1 in 4 people actually have their blood pressure controlled. And it's because they're informed. Again, this is about when you know better, you do better. So
Yeah, so 50% have it, and only 25% of them
are
managing it. Yeah. So check it, guys. And this is something you control. I think one of the things too, 80% of heart disease is preventable.
That's the good news.
That's the good news, right?
And diet is so important. Yes. Yes. 100%.
So we talked about the numbers a little bit, like, well, what should people look for? Like, I mean, I think we're saying check your blood pressure, check your A1C, like.
Yes, all of those. And I think it's also important just to realize that, and I don't really know why this is, I think because Black women do tend to look out for just about everyone else. You know, 58% of Black women have high blood pressure compared to a little over
58%.
Yeah, 58%, as compared to a little over 43% for white women, of all women. And that's a big differential, right? And I'm looking at my numbers, Black Americans are 30% more likely to die from heart disease than white Americans.
Yeah.
And it's preventable. So these are all the things that when you, like I said, you know better, you do better. And it's so important that we understand these statistics so that we don't become one, right? When you know that, you will understand, I need to know what my blood pressure is. I need to understand what hypertension is and how to manage, if you do have it, how to manage it.
Right. You know, I looked up some other numbers too about families and stress, you know, because I really believe stress caused my breast cancer. And 31% of Black people are married. 70% of Black people are married. Sometime married. 31% of Black people are married.
Are married.
70% of white people are married.
Okay. Wow.
31%. What does that say?
But they have to be married.
And that's
They can't be with all
I know, they
nonsense
should be
going
getting more
on.
stress. But I mean, that's factors. So also, I found a data point that 70% of Black moms are single moms.
That's stressful right there.
Black families tend to have 2.4 children. White families have 1.7 children. I don't know how to split 1.3 child, but yeah, just overall, right? So those are all stress factors, right? Is marriage a stress factor to have it or not have it? I don't know, but
yeah, for sure.
Yeah.
All right, so we're gonna go to the next polling question.
Okay.
It's gonna come up on the screen in just a second. And this is all about knowing your numbers. So when was the last time you checked your blood pressure? I know you did this morning.
Last week.
Last week. I checked mine last week.
there's a screen up there.
Is there a screen
Is
coming?
there a screen coming?
Something?
It's coming, I think,
Last week? Okay. Who checked their blood pressure last week? Okay. That's actually not bad. That's pretty good. That's pretty good.
pretty good.
So one thing that everybody can do this week or next week is check their blood pressure.
Yeah, who has the blood pressure cup at home?
I do.
Yeah.
100%. There we go. All right, here's the next one. This one, what is the one thing you're promising yourself to do as it relates to this conversation?
Are you gonna book an appointment with your doctor? Are you gonna learn the numbers? Are you gonna have a family conversation? Or are you gonna make your health a priority? Who knows what your A1C is? Is it high? Is above 5.7? Isn't that the number 5.6?
Things is so important. Oh, did you?
Yeah. I'll make my health a priority.
Well,
Yay.
please and thank you.
Please, thank you.
No, it's just say no.
Ricky, can you talk a little bit about what people can actually do when they're going into an appointment with their doctor? And that's really important.
First thing, don't go alone.
And if you have to go alone, record the conversation.
Record the conversation or FaceTime somebody. They may not be able to go with you, but get them on FaceTime. I've been thrown out of many doctors' offices on FaceTime and I don't care, but FaceTime with somebody and record the conversation. Now, like my doctor used to say, I know to record the conversation.
It's actually just in the room.
Yeah, they're in the room, yeah, so get the information, but don't go alone. Prepare for your visit before you go. For breast cancer, we actually have a list of questions to ask your doctor before that first visit. First one is there a clinical trial available for me? But prepare for your visit. Don't just show up there. Think about, is something bothering me? You know, we have people who have backaches for a year and it turns out to be cancer. Well, a backache, well, it's cancer or it's a recurrence. And so prepare for your visit. Think about your body. Think about things that could be bothering you that you really don't even think about every day because they're so you're normal. Like, you know what, I walked that knee kind of hurts a little bit. Make a list of those things. So prepare for it. And then tell that doctor, pretend you're me. put on this robe, and I'm gonna put on your little white coat. So in this conversation, let's exchange roles.
I have one better. I asked them, what would you tell your mother or your sister to do?
Well, that's what.
Because whatever you tell them to do, that's what I want you to tell me to do.
That's where I was going.
And it's so interesting, because I've said that before, and they're like, oh, well, because you don't see me as your mother or sister. But then they're like, wow, I should probably be applying that to all my patients. 100%.
Yeah.
Right? So that is, to me, that's the litmus
I
test.
tell them, close your eyes. Close your eyes and pretend like I'm your mother or your sister.
That's it. That's it. And it really takes me back to
It takes them back, and especially, and I can't change, none of us can really change racism and illicit bias, but what we can do is be informed and help each other and ask the questions and challenge the doctor and be the CEO of our own health. That's my third thing. You're the CEO of your body.
I think also thinking about the questions that you want to ask going into that meeting, because it's a meeting. And most oftentimes, it's probably no more than 10, 15 minutes, so you need to be ready with questions. I know I had foot surgery, and the doctor was like, okay, what questions do you have? And I was like, I had to be ready, or else I thought he put me up, because he always got like 5 or 6 people waiting down the hallway. So you have to be ready with your questions. And I know, I can't remember who said it earlier, but make sure that you are with someone that you trust and that is respectful to you, because you deserve that. You are paying them to take care of you. And so you should be able to be in a conversation and feel respected and not talked down to or feel like you're intimidated. It's so important that you are in that room and you sit squarely in that seat and you look them dead in the eye and you ask them the questions that you need to know so that you can take better care of yourself.
Yeah, we actually had a breast cancer survivor who said, she would tell her doctor, I don't want the McDonald's drive-through appointment today. I want the Ruth Chris appointment. I want the appetizer, the cocktail, the salad, what do you call it? The sherbet after that, of course, take for your palate. I want all the things and take your hand off the door because I'm not done yet.
That's it. That's it.
I was telling my doctor, doctor rates, I do not want to talk to her. Was it the physician? They were talking to me, I'm sorry, I'm not, is this half price? I'm sorry, man,
What about the real deal? I don't know the degrees. So what are some things that, one of the things you and I talked about is knowing your family history.
Yeah.
And can you give us some advice on some of the things that we should know about our family history going into that conversation with our doctor?
Everything. And we have a worksheet on the table back there in our bag called What Know Your Her Story. But you really need to, and you know what, you guys are on vacation now, who's in the house with you, sit down with them, our worksheet will help you fill it out. But you want to know how everybody died in the family, for generations as far back as you can go. Because look what you know from your parents, right? Look what you know from your parents. Look what you know from your grandmother. It all counts. It all counts. My dad had colon cancer. Could that contribute to my triple negative breast cancer? I don't know, but my father died. I found out on Friday, died on Monday. I knew nothing. So have we talked about it? I mean, I knew nothing about cancer 20 years ago, but have we talked about it? Would he have had a different outcome? Or would I have had a different outcome? So we can make decisions on that. My older daughter had a prophylactic mastectomy 2 years ago because of my 3 generations of breast cancer. So she's like, I'm not happy booked up on your wife, Now I have another baby, but she's good with bottles. But I mean, but we can make decisions and change our lives and change the trajectory of our kids' lives with knowledge.
And one of the things, if someone in your family is diagnosed with cancer, you can get cancer genetic screening.
Yes.
And that's really important. So when my mother had triple negative breast cancer, I went through genetic testing to make sure that I didn't have a BRCA. And so that's also something that if it's not offered to you, that you ask for.
Ask for it.
Because it is, if someone in your family is diagnosed with cancer, it typically is something that they will ask you about. So don't be afraid to do the genetic testing. It's better to know than not know, for sure.
And frankly, our family history with Black people is really just as significant because that genetic testing was based on my father. You know, so, and I really tell people, if you have cancer somewhere in your family, just assume that you are at risk.
Yeah.
And screen, get screened for everything, colon, lung, all the things. I think Tim put up. Oh,
This is the doctor visit plan.
Yeah,
Awesome. So we have this as a plan.
It's in the bag,
Yeah, for you to take with you. So I think maybe want to transition to Q&A now?
Yeah.
Okay.
Yeah.
So we are not medical doctors. I just want to preface that. But we do want to open up any questions that you might have. And we'll answer to the best of our ability. We do have.
We have Dr. Pierre.
Plastic surgeon here.
He's also cute.
There were questions in the back.
Oh, okay.
Dr. Pierre, you want to come back up here? He's also cute.
As he's laughing in my seat, I'm like, dude, you need to come up here. And I did play a doctor once in a play. And I woke up at a Holiday Inn, so.
I have 2 honorary doctors right there. So they call me Doctor.
Yeah, she's the first question.
Hi, my name is Vanessa. Thank you so much for this, very informative. But one of the things that I would like to touch on is for genetic testing. A lot of insurance companies don't pay for that. So what's your workaround that?
You said a lot of insurance companies don't pay for what kind of
Genetic testing.
Genetic testing. Okay, I don't know your solution because I know when my mother was diagnosed with breast cancer, they did it for free through the health system that my mother was being treated in. So they didn't charge me. So it's something to ask for. Ask them, does the health system, will they cover the genetic testing because my family member has breast cancer? Because I didn't pay for it.
Yeah, we actually work with a nonprofit called the Wisdom Study. And if you have not had breast cancer or any kind of cancer, you can participate in this study. It's thewisdomstudy.org. I think they go through cycles of budgeting, so they may not be able to always do it, but they give it for free. But also call me and we'll figure something out because our navigators are pretty good at convincing insurance companies to cover it. They I don't know what they do, they're pretty magical, but we always can make it happen.
I was gonna say, and use your resources because, it's just like anything else. You call, you get somebody that's nasty or doesn't want to help or they just aren't able to help. Call someone that has access to other resources that you might not be aware of. Just being here and having this connection with Ricky and with Touch is invaluable because if someone in your family or someone that gets some form of cancer, this is a place you could at least go to get connected with someone that can help you if they can help you directly.
No is never the answer. It's always how.
New opportunity, that's what no stands for.
Yeah.
Is there a question? Oh, yeah.
This is just 2 other possibilities. Number one was they're commercially available, they're available to consumers, so there's one version to pay out of pocket. The second one overlaps with the comments earlier about the clinical trials. Several of the clinical trials are based on genetic screening. So when you look for clinical trials, you don't have to be a patient. They're just clinical trials that are around clinical screening for disease, and that gives an opportunity to get this complete genetic screening. So there are a couple ways to do it that don't involve having insurance.
One of the things that we find with clinical trials is you really need to get genetic testing and genomic testing to find the best drug for you, especially with cancer. So we can always help you do that.
And a lot of the new treatments are coming out, they act like it. So if you have that genetic marker, it's like a lock and key. Then we know that will work for you because it fits together.
Yeah, I kind of describe biomarkers as like every cancer cell has some freckles on it, and those freckles could mean something that's significant to your disease that you could be treated for. So you got to look for the freckles.
Right. So the question? Oh, yes.
This is an awesome discussion. I spent 15 years of my life in population health arena, the other 15% in geriatrics. And hypertension is just, it's almost like, do you have blood in my family? Hypertension.
And I had briefly mentioned, I was told by my primary care provider that I need to take a atorvastatin. And then I had the fear of dementia because of word on the street that if you take it for a prolonged time, that you could develop early signs and symptoms of dementia. And I do not like the idea of taking anything for the rest of my life. Like I can't get control of my health. So I really wanted to know, and I know you don't know it specifically, but in general terms, is atorvastatin something that we should even take? Because my primary care does not look like it. He doesn't look like it.
It's a great question. I mean, it's complicated, so to make it brief here is that atorvastatin will drive down the total cholesterol level, and the total cholesterol is one of the major drivers of heart disease. So that's the basis for that. That said, it's an important question because it used to be at high cholesterol, someone writes you a prescription, and that's end of school work. But it's a much more complicated formula, and the formula is the right term, which means that what you want to make sure, and I would use these terms with your doctor, are they using guideline-based medical therapy? And the reason why guideline-based, when the guidelines change, but they often will adjust whether we should be taking the drug or not based on all the other risk factors, looking at you as a collective, as a patient, not just as a single number on the page. So when you speak to your doctor, ask if they're using guideline-based medical therapies.
Thank you.
And you can always call us. We'll go ask them. I'll call them.
Real quick, I was going to say, you just did. Did you just say this? Because I'm on a atorvastatin. So I just asked my best friend, Claude. I called my cousin now. It says atorvastatin and other statins do not cause permanent dementia or long-term cognitive decline. So some of the side effects may sound like they could, and people just kind of claim it. But no large study has determined that. But I'm getting on.
I may not be right all the time.
Yeah, I may not be right. Yeah, I'm just saying.
I think it's one of those things, and if you don't trust your doctor,
Yeah,
confide in your doctor. Get a second
Get a
opinion
second opinion.
and see. Yeah.
Every insurance company has to give you, let you get a second opinion. Never hesitate about that. And if your doctor feels some kind of way about that, then they have to feel some kind of way about that. They'll figure it out.
Another question back? Yes.
Well, she's.
Oh, sorry. I didn't see mine.
Thinking about, somebody asked a question earlier about insurance companies paying for things. And I agree, I think that this is a fabulous discussion. But I think a lot of this, being from a family of physicians, one of which chose to leave because she couldn't see her patients. She's controlled by the insurance companies and she hates it. But I still like to say how some of these things are really good things, genetic testing and even just simple questions, even just knowing the questions to ask and having time to do it, or having choices, finding a new cardiologist. Insurance companies control that. So my question, I guess, somewhat relates to what Malik was saying, is how do we, as regular REGLA folk, how do we engage with the health systems when we can get genetic testing, we do have time to ask, we can have our choices to say, okay, you know what, I'm going to fire this doctor. My HMO plan doesn't pay for this doctor or that doctor. So how do we, and it's across the board, including cancer and everything, how do we engage with the health system so that we can take care of our hearts and all things like that?
I have two ways to kind of navigate that. The first way is, when we talk about population health, one of the things we say is policy. Yeah. Policy drives coverage, drives everything. When things are mandated, when policies begin to cover things, I know in the state of Pennsylvania, it actually covers biomarker testing. That was because we had a group of people that says we ought to be able to get biomarker testing if we have this in our family. People got together, went to their legislators, and it took a minute, but now biomarker testing is covered, required coverage in the state of Pennsylvania. for certain things. So policy, being active with your legislature and letting them know that this is what we expect as patients, that's one. On our side, on the what I call the industry side, we know we can't do this without partnering with the payers, with the health systems, because it's an ecosystem. It all works together. We can't solve a problem if we're not in partnership with the people who are doing the coverage. So I was actually in a meeting in Virginia Commonwealth University, and we had Anthem Healthcare, we had state Medicaid, and it was us. And the lead of VCU, he just left VCU to go to Temple, Dr. Ren. We were all sitting at the table saying, breast cancer screenings need to improve in the state of Virginia. To the demographics, we actually can go by zip code and see what is the incidence and the prevalence and the treatment by zip code, not individuals, but just sort of high numbers in terms of aggregated numbers. And sitting around that table, we each committed to the thing that we could do to increase and have a goal to increase cancer screenings by a certain date. That's what we can do on our side. I think as a regular old patient that we all tend to be sometimes, is becoming active for things that you're concerned about and that you want to see have changed. So those are just two things that I know can help them change that.
Can I add one thing too? I think that, we see so many women who, especially young women, who think they're insured. And then they get breast cancer. And they have insurance from their company, but guess what? They pick the choice that has the lowest deductible, or pick the choice that was the cheapest or whatever. So I tell every young person, everybody, every year you can change your insurance policy if you're working. Look at the fine print. Look at what you're buying and what's covered and what's actually covered. So many women come and they get the free mammogram, but they can't pay the $2,000 the next day for the diagnostic testing to see whether they have cancer or not. So look at that stuff every year. Evaluate your insurance. Think about what you're buying, because you're buying it, right? Maybe your company's supporting you to buy it, but look at those choices and try to make the right choices that assume that something could happen to you and you need to be prepared.
The other thing for Medicaid covered people, Medicare, Medicaid, if you say that you don't have coverage, there's actually different rates for people who are not covered versus people who have commercial insurance. So it's always doesn't hurt to ask, what is the, I don't have insurance, what's the uncovered rate? Ask the question. 100%.
One thing I might add is, I think you've heard this as a theme today, is these systems are hard to navigate on your own. And what you're hearing from Ricky, and to be what you're hearing from Carolyn as well, is that there are patient advocacies and patient navigators that can help you to move through the system. So when you find yourself hitting up against a block, you're getting a no, there are nonprofit organizations, there are advocacy groups. Ricky's group is a perfectly good example of that can help you to move through the system so you're not doing it alone.
You're not alone, and our navigators are 24/7. You can call us, we can give you the number, and they'll talk to you anytime about anything, and they move mountains for patients. I don't know what they do, they're miracle workers.
Angels.
Are
there any more questions? Yes.
So first, thank you. This has been a fantastic conversation, and I'll just say, one, it would be wonderful to get your information so that we can have follow-up questions, especially on the advocacy part, because I do think that when people find themselves in the system, it usually is not because they have slowly gotten in there, right? It's usually a crisis.
It's a crisis.
You find yourself in the system.
Yeah.
And along those lines, in particular cancer, right? That it not only brings the patient into the system, but it brings the entire family and those connected. So I'd be interested in your thoughts about how therapy sort of, plays in with taking care of their own health, especially when it's not necessarily the patient or those who have cancer. But I think cancer in particular is it has such a dramatic impact on the entire family And therapy is something that people don't often talk about openly, but it can be such an important tool in navigating both the system and the process.
Come back next week. We're doing a caregiving day and we're doing a mental health day. We have an awesome doc, Wendy Mayo, who basically she does mental health and counseling for cancer patients, cancer families. And it is a family disease. My whole family was had cancer when I had cancer. But we're talking about that next week. It's a huge part of the conversation. It's on our little schedule there. I don't know what day we can tell you, but and everything, if you're not here, we're recording it too. But this is my mom. She died on July 3rd, and I was her caregiver. She was 93. She lived a great life, but being a caregiver is really hard. It's no joke, and she did not want to die for a long time. I'll tell you a quick story. About a month before she died, she's like, Ricky, I hear voices out the window. I'm like, Mom, there's no voices, nobody out there. And so I said, what are they saying, Mom? She said, they're talking about construction. I said, they're building your house in heaven. But make sure it's up to par. She fought like a girl, until she didn't want to do it anymore. But I mean, I think we're all experiencing that with our parents, and we're going to talk about all of that stuff next week. So important. And mental health, breast cancer. I mean, my doctor said, do you want to talk to a therapist or a psychiatrist? I'm like, well, is that going to help my breast cancer? And I did, and it was one of the best parts of my treatment.
Everybody should have a therapist.
Everybody. I can start at age 12.
Everybody should have a therapist. Full stop. Everybody should have a therapist. There's something about being able to talk to somebody that has no skin in the game.
Right.
Not your best friend like mine said you were too.
Right.
It is just an objective third party that can just kind of hold a mirror up to see what you're saying.
Yeah. And show yourself.
And show your full self.
Yeah.
I highly, it's underrated, and everyone should have a therapist, especially for Black America.
Yeah. And we're going to talk about it next week, so come back.
Absolutely. Okay. So I think that we're going to wrap this up, but we didn't want, and into the therapy piece of this, the mental health piece of this, we thought we would end with a meditation. Yeah. So I'm going to ask everyone to just kind of take a deep breath, put both feet on the floor. She's been doing it for 4 years. I changed companies, and it was a pandemic. I'd taken a global job, in February 2020. So excited to be traveling the world, closing down companies, so excited to start a new one. And I was traveling the world in my office, March 16th. So Sri Lanka, 3:12 in the morning. So I decided that I think COVID was just such a horrible time for everyone for so many reasons. I was like, I need to do something. And I said, I'm not gonna just go to yoga in a mask. I'm gonna actually become a yoga instructor. So I got my yoga certification, but when I went to sign up, so I paid all the money. And they said I need to get 10,000 hours of yoga. I was like, well, I ain't gonna do 10,000 hours of yoga. But what I will do, I could supplement that and get extra credit if I did meditation. So I was like, okay, good, because then I'm like, meditation, I can sleep if you wouldn't even know. So I did meditation, and I've been meditating since, as a practice since 2020. And I will tell you, there's something beautiful about meditation, because what I found is that something will happen to me and I cannot actually pause. Like I can actually see myself and say, you don't want to say that, because the implication of that is going to be just, you won't have a job. You just need to just think about another response. And it creates a space between you and what happens to you so that you can appropriately respond and respond like a way you'd be proud of. So I would ask for everyone, I know that beach is calling, but we're not gonna make this a long one. But I just want you to be able to say that the one thing that you did today is you took a few minutes to take some deep breaths and to focus on you. You all came in here today and you hopefully wrote something on the heart, something that's on your heart. And so I want you to think about what it was that's on your heart, that person, that thing. I would love you to put both feet on the floor. Put your thumbs down. And I'm just going to walk you through a quick body scan and some deep breath exercises. And I want you to take a mental note of how you feel right now. And then when we're done, hopefully there'll be a difference. Okay, so both feet on the floor. I want you to close your eyes. I want you to unwrinkle that little space in between the eyebrows. That place just gets so scrunched. I want you to smile on the inside. I want you to feel your heart and feel a smile come across your heart. And I want you to take a deep breath in. We don't take deep breaths. We are shallow breathers because of the society we live in. So I want you to take a deep breath in and count 1, 2, 3, 4. Hold. 2, 3, 4. Exhale. 2, 3, 4. And rest. 2, 3, 4. Again. Inhale. 2, 3, 4. Hold. 2, 3, 4. Exhale. 2, 3, 4. Rest. 2, 3, 4. One more time. Inhale. Hold. Exhale. Rest. Now I want you to feel the bottom of your feet. Feel the sensation in the bottom of your feet. Tingling. I want you to go each toe, feel each toe on your right foot. On your left foot. I want you to feel your ankle. The two calves. Your shin. Your knees. Feel the joint coming together at that intersection. Your thighs. Glutes. Your back. Count up each vertebrae. Ten more. 5 more. The base of your neck. The front of your neck. Your shoulder, right shoulder. And your arm connects to your shoulder. Down to your right elbow. Your right forearm. And each finger, check in each one. Your left shoulder. Your left forearm. Your elbow. Each finger on your left hand. You come back to your neck. Feel the sensation of your scalp. Tingling. Back to your forehead, your eyes, your nose, to the deep breath in and deep. Another inhale. And exhale. One last inhale. And all of this sigh, which is your thanks and your grace, and all that you bring, and all that you're going to do, and all the fun that you're going to have for the rest of your time here in the vineyard. Thank you all so much for coming. Really appreciate it.
So we have lots of material.
Yes,
We
the
have
materials
popcorn,
before
we
you
have
leave,
snacks.
please take
Yeah.
some with you.